I defer to Senator Collins.
Thank you very much, Senator Cassidy. Welcome, Doctor. The National Cancer Institute that you currently lead has the largest budget and research program of the 27 institutes and centers at the NIH. Cancer research is vitally important, and I strongly support it. I'm interested in how you will balance NCI priorities while making NIH-wide budget decisions. For example, President Biden's budget request proposes a substantial increase for the NCI, but it flat funds research for Alzheimer's disease and diabetes, which collectively affect more than 40 million Americans. If confirmed, how will you balance your background in cancer research and your leadership at NCI with the need to be fair in evaluating agency-wide priorities?
Oh, thank you for that question, Senator Collins. And I will say that, first of all, if confirmed, my commitment as NIH director is to the health and vitality of every single American. But I can give you some specifics to address your specific question. You know, how does a cancer surgeon really lead an organization that deals with the huge spectrum of conditions that the American people face? I have two answers to that. First, as a cancer doctor, I took care of patients of all ages, all walks of life, all different health states. I am very familiar to working with colleagues in cardiology, in mental health, in opioid use disorder, in kidney disease, to take care of my patients with cancer. And I feel very comfortable engaging with the broadest possible team of researchers focused on bringing health to people. But second, one of the things that to me is the most exciting about the opportunity to lead the organization is the fact that so many of the diseases that we are working on, individual diseases in our relative silos, really have many common elements. The need to have care access to every community, but even down to the biology. So my field of research was in inflammation and how inflammation causes cancer. Well, guess what? Inflammation is one of the major inciting factors behind Alzheimer's disease, behind autoimmune disease, behind long COVID, behind arthritis, so many things. So both on a scientific level and on the taking care of human beings level, I'm really excited for this opportunity to lead NIH.
And as you know from our discussion in my office, I would like to see NIH fund more projects and more research looking at the role of inflammation in Alzheimer's disease, for example, instead of just funding amyloid plaque, important though that is, research. We've had that discussion. My time's growing short, so let me switch to diabetes. Along with Senator Murray and Senator Shaheen, I had the honor of co-hosting again this year the JDRF Children's Congress this summer. And the NIDDK director, Dr. Griffin Rogers, said that with continued research, it's possible to imagine that people could lead a life free of the burden of type 1 diabetes and its complications, which is very exciting. So we have, as you know, a special diabetes program that is up for renewal, and this committee has overwhelmingly approved its reauthorization. I want to make certain that you understand that that program is intended to supplement and not supplant the regular appropriations. Part of the program goes for type 1 diabetes. Part of the program goes for type 2 diabetes with a special focus on Native Americans and Alaskan Americans. So I'd like to hear your reassurance that you do understand that's additional funding.
Oh, thank you, Senator. I will just say that the researchers and team at the NIH are deeply grateful for the resources we get from Congress that allow us to serve people and embrace with the greatest enthusiasm particular communities and efforts that focus on serving people. So thank you.
Thank you.
Senator Murray.
Thank you.